Welcome back and thanks for staying with us. Let's take you straight to news on the go. Another G20 meeting is currently being held, this time in Sandton in Johannesburg. It's around African Union's pandemic preparedness response. You might remember, of course, President Cyril Ramaphosa is the AU pandemic preparedness response champion. Put simply, this is a G20 meeting focusing on ways through which countries, more specifically on the African continent, can better foster their own manufacturing to reduce reliance on the global north. It's an issue that came into prominence more specifically during the COVID-19 pandemic. You might remember questions around the hoarding of vaccines were huge issues. And in fact, there were calls for Africa in particular to look at bolstering its own healthcare systems, all in an effort to ensure that they reduce their reliance on the global north. But more recently, of course, we've seen just a shift in geopolitical arrangements, especially when you consider just the Trump administration's resolve in putting America first, as he would put it. And in fact, what we have seen are more calls for African countries to, for example, not rely as much as they did on other countries, especially when it comes to issues to do with aid for programs like HIV and many others. In fact, let's take you live to Sandton now and listen in to how this G20 meeting is unfolding.
His Excellency Professor Benedict Orama, Her Excellency Mrs. Nardos Bekele Thomas, Her Excellency Ms. Sandra Kama, our Honorable 2025 G20 Sherpa, Mr. Zain Dango, Heads of Mission in South Africa, Your Excellencies and AU agencies that are here, esteemed colleagues from South African government departments and our entities, especially in the health sector, members of the media, honored delegates, Sawubona, Dumelang, Goeiemorgen, good morning, and welcome to this high-level ministerial dialogue, an official G20 site event that unites African leaders, G20 partners, and global stakeholders to tackle a defining challenge, an opportunity of our time, securing healthcare self-reliance for Africa by accelerating pharmaceutical manufacturing. On behalf of the government of South Africa, I thank you for joining us. Your presence reaffirms the collective resolve of the G20, the African Union, and the international community to bridge persistent gaps in Africa's health systems and empower the continent to chart its own pharmaceutical and healthcare destiny. In recent months, building on what we've come to call our new normal of economic shocks, climate extremes, and political volatility, COVID-19 laid bare the fragility of global supply chain and the peril of overdependence on external suppliers for life-saving medicines and vaccines. Many African countries found themselves at the mercy of distant markets, facing vaccine inequity and crippling shortages. Yet, even amid these trials, Africa's response was nothing short of inspiring. The rapid launch of an African medical supplies platform by Afrexim Bank, pioneering efforts in local vaccine production and agile public-private collaborations demonstrated our capacity for innovation, solidarity, and transformation. Today, as the world begins to reconfigure itself into yet another new normal, we stand at a pivotal crossroads. the reminder of being left in the lurch. So the future of Africa must be one in which we lead our own development, manufacture our own medicines, and tailor health solutions to our unique continental needs. This vision, at the heart of Agenda 2063, the African Union's blueprint for the Africa we want, a continent that is prosperous, that is integrated and self-reliant. Under President Cyril Ramaphosa's stewardship as Africa's pandemic preparedness response champion, South Africa has championed continent-wide industrial integration. We believe that localized and regional pharmaceutical manufacturing is the linchpin of health sovereignty, job creation, and economic transformation. Yet, achieving this vision demands three foundational pillars: collaboration, innovation, and shared purpose. And it comes at a time when donor aid to African healthcare programs is either completely removed or contracting sharply. These cuts carry consequences that extend far beyond our borders. Infectious diseases, whether resurgent malaria, drug-resistant tuberculosis, or emergent zoonosis, these diseases do not respect boundaries and threaten global health security. Reduced funding stalls vaccine research and distribution, delaying the world's ability to respond to future pandemics. And because our economies are interconnected, disruptions in Africa translate into trade shocks, labor shortages, and slowed growth worldwide. In short, cutting aid is not merely a setback for Africa. It is a collective risk to global stability, prosperity, and the healthcare of all nations. To address these intertwined challenges, we must focus our efforts on three strategic interlocking objectives. Firstly, accelerate local manufacturing. We must rapidly expand capacity for active pharmaceutical ingredients, production, formulation, and fill-finish operations, especially for vaccines, antimicrobials, and chronic diseases treatments. Public-private partnership underpinned by tax incentives, streamlined regulations, and guaranteed offtake through pooled procurement can de-risk these ventures and attract both domestic and diaspora capital. Establishing pharmaceutical-focused special economic zones may be with fast-track licensing, robust quality assurance framework, and shared services such as analytical labs and logistics hubs will catalyze industry growth, ensure compliance with international standards, and foster local entrepreneurship. The second one will be institutionalized pooled procurement. Aggregating demand across our 54 nations is the most effective way to secure better pricing, predictable supply, and stronger bargaining power. The African Continental Free Trade Area provides the regulatory and tariff-friendly environment necessary to harmonize standards and integrate markets. By expanding platforms, designating regional manufacturing hubs across the continent, we can achieve economies of scale required for sustainable production, equitable distribution, and resilience against future shock. The third one will be mobilize African-led finance. To offset shrinking donor budgets, we must unlock African and global capital by offering clear incentives for investment and partnership in pharmaceutical manufacturing and infrastructure. Institutions like the African Development Bank and innovative vehicles such as the African Prosperity Fund can provide patient, concessionary finance tied to local value addition, job creation, and technology transfer. None of these objectives can be realized without a skilled workforce and a culture of innovation. We must invest decisively in pharmaceutical science program, technical vocational training, and regulatory capacity building. Fellowships and exchange programs with leading global research institutions will ensure our scientists contribute to and benefit from cutting-edge discoveries, nurturing a new generation of African inventors. Honorable ministers and distinguished delegates, the era of unlimited aid has passed, but Africa's collective ingenuity, solidarity, and market power offer a powerful counterbalance. By coupling accelerated manufacturing with pooled procurement and African-led finance, we will not only replace lost aid, but build a healthcare system that is more efficient, resilient, and equitable than ever before. We can ensure that no African goes without life-saving medicines or medical supplies, and that our continent emerges as a net exporter of healthcare solutions, generating jobs, stimulating research, and fostering inclusive growth. Let us commit here and now to deepen the AfCFTA implementation, institutionalize pooled procurement, mobilize African capital, and invest in our people for our people. In doing so, we will realize Africa's long-cherished goal of health sovereignty and demonstrate to the world that when united behind a shared destiny, Africa's potential is limitless. On that note, Program Director, I officially welcome you to this dialogue. Let us work together with agency and resolve to make history. Thank you very much.
Thank you very much, Deputy Minister, for that hearty welcome and for starting to take us into some of the more practical aspects of our discussion today. And we would just like to pass on our sincere condolences to Minister Buthelezi. He really was very committed to be here, but unfortunately, sadly, he is on bereavement today, bereavement leave, and so please spare him a thought. So thank you so much, Deputy Minister. And now we would like to invite His Excellency, the Secretary General of Africa, Mr. Wamgele Mene. He will deliver his keynote address via a video message. Thank you very much. Secretary General of Africa, Mr. Wamgele Mene, he will deliver his keynote address. General of Africa.
All right, that's our live shot for you inside Sandton, and that's where the Africa Healthcare Systems G20 meeting is currently underway. And essentially, it's about how countries on the continent can bolster their own systems and reduce reliance on the global north. And we've seen many instances where something like this would be helpful during the COVID-19 pandemic, when there was a scarcity of vaccines, and more recently with Donald Trump pulling funding, of course, from a number of countries, including those in Africa. In fact, the Deputy Minister saying the era of unlimited aid has now passed. I wonder what tangibles are going to come from this meeting.